Administration of oxygen. Learning objectives. By the end of this video, the participants will learn to administer oxygen to newborn and sick children at the correct rate and concentration. To learn the skills required for correct usage of nasal prongs, oxygen hood, nasal catheter and face mask with their indications, advantages and disadvantages. To know the working of various parts of equipment used for oxygen therapy. To know the functioning, maintenance, cleaning and disinfection of the equipments. Oxygen sources could be oxygen cylinder, oxygen concentrator or centralized supply through manifold. Indications: newborn babies, infants and children with difficult breathing, gasping or chest indrawing. Central cyanosis, shock. Respiratory rate above 60 in neonates up to 1 month, 50 in infants from 1 to 12 months, 40 in children from 1 year to 5 years. Please remember, administration of oxygen is adjuvant to treatment of underlying conditions. It is important to understand that oxygen is a drug and its unindicated use may lead to complications. Complications: too much oxygen causes retinal and lung damage in preterm newborns. Too low concentration of oxygen causes further hypoxia. Cold oxygen can cause hypothermia in newborns. Oxygen cylinder and accessories for oxygen delivery. Oxygen cylinder with trolley and spanner. Regulator, pressure gauge or flow meter. Humidifier bottle with distilled water. Tubings. Nasal prongs, nasal catheters, head box, face mask, stopwatch. Preparation for oxygen therapy. Oxygen cylinder. Please ensure that the oxygen cylinder in the trolley is secure and will not fall over. The knob or valve is opened easily with a spanner. The regulator and gauge are directly connected to the oxygen cylinder to reduce the high pressure in the cylinder and keep the flow constant as oxygen is used. The flow of oxygen by checking the presence of air bubbles in the humidifier before and during the administration of oxygen. Please also note, the gauge indicates the pressure of oxygen inside the cylinder. Normally, when the cylinder is full, the pressure is 1600 kilopascal and when it goes below 800 kilopascal, then it is time to replace the cylinder. Gently tighten the regulator. Do not use excessive force. If too tight, it may need a wrench. A flow meter is connected to the regulator to control and monitor the flow of oxygen. the flow meter should be vertical. As oxygen in the cylinder is dry, therefore humidification prior to use is necessary. For this, fill the humidifier with distilled water up to the mark on the bottle attached to the flow meter. Remember to clean the bottle and change the water in it every day. Connect the oxygen tubing to the nozzle of the humidifier and check that there is no leak. To check, place ear near the joints to hear sound and wet finger to feel cool airflow in case of leakage. Use proper tubing for oxygen supply, since hard plastic tubing will not easily bend or kink and interrupt oxygen supply. Adjust the flow of the oxygen in liters per minute with the knob on the flow meter. Read the flow from the middle of the ball in the flow meter. Oxygen concentrator. The oxygen concentrator may be used as a source of oxygen. However, it needs electric supply and regular maintenance to ensure that it is producing oxygen. Parts of oxygen concentrator. Machine with compressor. Air filter at the rear of the machine. Flow meter. Humidification bottle. Tubings. Membrane filter or molecular sieve inside the machine. Important tip: air filter should be cleaned at least fortnightly and also depending upon the usage, model and dust presence. Air membrane should be changed as per the manufacturer's instructions or at least once every year. Steps in using oxygen concentrator. Plug in the power supply cable. Switch on the concentrator. Once the concentrator is on, red light will come up. The red light will be on till the desired concentration of oxygen is achieved. Check the distilled water level in humidifying jar and ensure that it is up to the required mark. Adjust the oxygen flow as required. Deliver oxygen through the oxygen hood. Ensure that there are no air leaks. If pulse oximeter is available, monitor SpO2 and maintain saturation between 90 to 94. Alarm limits set at 89 and 95. Oxygen delivery. Oxygen can be administered using nasal prongs, oxygen hood, nasal catheters and face mask. Using nasal prongs. Using nasal prongs is the safest and preferred method for oxygen delivery. Nasal prongs are short tubes inserted into the nostrils. Ensure using the correct size. A flow rate of 0.5 to 1 liter per minute in infants and 1 to 2 liters per minute in an older child. Nasal prongs are preferred over a nasal catheter for delivering oxygen to young infants and children with severe croup or pertussis, as catheters can provoke paroxysms of coughing. Place them just inside the nostrils and secure with a piece of tape on the cheeks near the nose. Take care that the nostrils are kept clear of mucus, which could block the flow of oxygen. Oxygen hood. An oxygen hood headbox is a good device to achieve oxygenation in the newborn, in severely distressed infants, and in emergency situations. Using the oxygen hood. Select right size of the head box for newborn or infant. Place a head box over the baby's head. Ensure that the baby's head stays within the head box even when the baby moves. Connect through tubing to the oxygen source. The oxygen hood needs flow rates of 5 to 6 liters per minute. Minimum oxygen flow required for an oxygen hood is 3 liters per minute. Using the head box with a low flow of oxygen can lead to rebreathing of the expired air, and this is dangerous. Record time and rate of oxygen administration. The oxygen hood should be cleaned using soap and water. Never use spirit for cleaning. Nasal catheter. Use appropriate size of catheter. 6 French for a small baby and 8 French for a big baby. Measure the distance without opening the protective covering from the nostril to the inner margin of the eyebrow. And note the graduated mark on the tube. Gently insert the catheter into the nostril up to the mark. Ensure that the catheter is correctly positioned. The tip of the catheter should not be too deep to be visible below the uvula. The flow rate should be 0.5 to 1 liter per minute in infants and 1 to 2 liters per minute in an older child. This will deliver 30 to 35% oxygen concentration in the inspired air. Adjust the flow of oxygen to achieve the desired concentration. Clean upper lip with a damp cloth and bend and attach catheter with adhesive tape on cheek to allow some neck movement. Record time and rate of oxygen administration. Face mask. Select the right-sized face mask. Adjust the flow rate of desired concentration. Place the mask over the baby's mouth and nose. Secure the mask in place using elastic or by adhesive tape. Face masks need flow rates of 5 to 6 liters per minute. Use face masks only during emergencies. as carbon dioxide can accumulate at low flow rates and it is difficult to keep the mask in place, and this discourages breastfeeding. Record time and rate of oxygen administration. Troubleshooting. Please remember always that oxygen is highly inflammable and as such should be kept away from any fire or potential fire sources. Never use any oil or grease to lubricate the joints, as this may create a fire hazard. If the cylinder is not opening, always keep the cylinder key and a toolbox handy for opening a new cylinder smoothly. No oxygen flow or bubbles in the humidifier. Test joints and leakage in the tubing by immersing the tube in a bowl of water to check for bubbles and pressure gauge to see if oxygen is finished. Key points. Oxygen is to be used only when indicated and needs regular monitoring. Titrate oxygen flow rate to keep the oxygen saturation level between 90 and 94%. The distilled water in the humidifier should be changed daily. The preferred route of oxygen delivery is via oxygen hood and nasal prongs.